All right, so now it's time to pull out medication and give them to her patient. What we've made in this simulation area is this own area over here just for medications. That's a separate room from the patient. So as far as your gelling in and gelling out, that's something you'll have to figure out on your own. But over here is where you're going to prepare your medications. Inside the medication station, we do have a copy of the physician orders as well as a copy of the MAR, so that when you're doing your checks and verifications, you're able to do it in real time. You don't have to worry about one of the other people that might have the chart. The medication nurse has their own copy. The sign-in and the password frequently have to be updated, so instead of making you guys try to memorize that, we've made it very simple. We write the passwords right over here down for you guys. We keep it over there. So you're gonna sign in with whatever the current password would be. When you hit OK, it's gonna say, hey, just making sure you know we're in simulation mode. These same machines are used in hospitals as well as simulation centers, so it's just letting you know it's in simulation mode. It's okay, guys. Just press the OK button. Next is going to present a list of all of the patients that are in our imaginary hospital. This patient that we're using for this example is Dwight Schrute, S-C-H-R-U-T. I'm going to go back and compare that over here. Instead of typing by first name, we don't use those in the hospitals, we use the last name. So SC, and boom, Dwight Schrute comes up. You notice the account number is going to be right here. For his number, 0898, and you'll look over here at his actual medical record number, and that should match up identical. What you might get confused on is you might see the admission date and his birthday. Those are going to constantly be changing. Don't worry if the birthday appears wrong or the admission date appears wrong. That's something from the internal side that we have to fix. Don't worry. On all patients, because we don't want to have to update these patients' birthdays every year, we made them all like this. So you'll see his birthday is 5/18XX, and his name is his age is 27. So as the patient, if I'm responding, I'm going to ask, or you'll likely ask, can you identify yourself, sir? And I'd say, my name is Dwight Schrute. My birthday is 5/18 of whatever makes me 27. So don't worry about those XXs. And don't worry about it over here on the admission date, but the account number should always match. So I'm going to pick Dwight Schrute. It's going to load his medication profile. In that medication profile, it will match whatever your MAR shows. So I see that on his MAR, he's due for ceftriaxone at 8 and albuterol at 8. So I'm going to find those over here. I see my ceftriaxone. I select it. It says, hey, how many do you want? That's something you'll have to do your own calculation on based on what the medication order is. In this scenario, it's just 1. I pressed OK. Where did it go? It's like an Amazon cart, guys. Don't worry, it didn't disappear. It just got added to your cart, but you haven't hit checkout yet. It's okay, you still got time. Once you've selected all of the medications you want, you're gonna press here to open drawer. But hey, he had 2 medications, so I'm gonna select both of them. He also had his albuterol that was due, so I'm gonna find the albuterol, pick it. How many do I need? I know from my calculation it's only 1 inhaler. I hit OK. Again, it's been added to my cart. I'm now ready to check out. Press to open drawer. Magically, the drawer is going to open. It tells you that ceftriaxone is in section D. A, B, C, D. Hey, look at there. Ceftriaxone, 1 gram. Matching it up. Yep, that's what I needed. Again, doing however many med checks, writes, and verifications are. By the time you guys graduate, they always seem to be adding more. Pressing here to access the next item. Now it's telling me the albuterol is in section A. Section A, here's my albuterol. Again, verifying everything is correct. Pressing here when you are done brings you back to the main screen. Before you walk away from the Pyxis, one of the most important buttons you want to do and know about is this log off button. Make sure to press it before leaving the Pyxis. We try to treat simulation like it's real life. In real life, you would never want to leave the Pyxis unlocked because someone would be able to use your password and information to pull out drugs under your name. You don't want that happening. The hospital keeps excellent records, and it's just a computerized program. So even if you have a receipt from Taco Bell showing you got a chalupa at 12 o'clock, if the Pyxis shows your name pulled out of Vicodin at 12 o'clock, the hospital's going to go with what the computer shows. So don't give out your password to anyone. Don't share it in real life. But for our simulation purposes, again, we've left it real easy for you. The password and the name are right there for you. That's it for pulling out medications. It's really easy. Now, you need to go give them. You might need to draw them up. Next to you will always be a table that's got syringes, some with needles, some without. If there is a medication you needed to dilute, there'll be dilution equipment available. And then you would then take it. You can grab your MAR and your physician orders and then walk to bedside, and we'll go show you how to go give medications next.